So talking about the mental health, it has its own aspects, that is the physical, mental, social, and the spiritual well-being. So all of these aspects are basically interrelated whenever we are talking about them. There are a lot of taboos that are related to these anti-psychiatry movements, basically, that are present in the developed and in the underdeveloped countries currently. So the taboos are sometimes related to the cultural differences that are present in the different topographical areas that we are dealing with, and sometimes how to treat with these taboos is again very important, because the people, they won't come up and recognize that there is a problem that is related to the mental illness. For example, we studied the psychomotor and we studied the somatoform phenomena. So basically they have their aspects of the mental illnesses, but sometimes the people won't relate to them, and they would say that there is some underlying pathology other than the mental illness that is contributing towards that somatoform or the physical disorder, and they won't really admit. And even sometimes the clinicians are against these psychological theories, and this is basically the foundation to these anti-psychiatry movements. But of course, the WHO has regarded the mental aspect as a very important aspect towards the health, and it is the part of definition since ever. And it's basically according to WHO, if a person has to be healthy, he's basically going to pass on towards all of these entities. That is, he has to be physically well as well as mentally, socially, and spiritual well-being. This is how we basically define a healthy individual. Then again, defining the child health is again very important. If we are considering that the child is healthy, he should be healthy in all of these aspects of life. He should be healthy physically, he should be healthy mentally, socially, he should know how to interact with the people surrounding him. He should be productive towards his or her community. He should know how to face problems and cope with the different stressful situations in his or her life. So the spirituality is again another aspect that has been added on in the definition, and the person should be at a spiritual harmony with oneself and with the people surrounding him in a particular culture. So it's basically a total entity that we have to deal with, and sometimes these taboos, they come into play, and whether or not if a person is suffering from mental illness, and if he or she is suffering from a mental illness, if he is accepting this fact, and if he's going to rely on the services surrounding him and go find help for him or herself, it's again very important. The realization point is again very important. Sometimes the people are in a state of self-denial. They won't really admit that they are suffering from a particular mental illness. So this awareness is again very important, just to give the awareness to the people around you that the psychiatric problems are basically prevailing in different societies in different manners, and one should know how to deal with the psychiatric mental illnesses, and one should accept the services surrounding them. That is basically the extreme help that can be given to the people suffering from these mental illnesses. But whenever we are talking about these mental illnesses, there are some anti-psychiatric movements that usually come into play, and that are the movements that we'll be discussing over here in this section. A lot of laymen people, as well as the clinicians even, they are anti-psychiatry, and they do not really accept the fact that the mental illnesses sometimes can be an explanation to a physical phenomena. So these myths and facts are continuously revolving around these psychiatric illnesses, and so one should know how to deal with these myths, and as well as how to provide services to the people who really are in need of these services. So the anti-psychiatric movements that came into play were basically some people say the mental illnesses doesn't exist at all. So that is quite an extreme, but we are only talking about them if they are particularly not considering the mental illnesses, then they can be from the underdeveloped countries, or they're not quite well educated about these mental illnesses. So sometimes they really do not say, they say that the mental illnesses do not exist at all. So the SASIS was one of the promotions that was given, and that basically laid its foundation on the fact that there is no such entity as mental illnesses. So it's a complete denial state, and one should know that this movement was basically it doesn't have any foundation at all, and you cannot really relate to this movement at all. Then the social labeling theorists, they came into play. Even in the West, they came into play, even in the developed countries, and even they were in a state of denial, and they said that mental illnesses can never be a cause to a physical phenomena. So basically, it's a complete state of denial, and one should not relate to these movements ever. The mental illnesses are sometimes a reaction to the unbearable stresses in life. So it's a normal phenomena that people usually in a stressful situation, if they are in a state of mind, and if they are in a stressful situation, they would sometimes be panicked. They would sometimes react to them in a depressive episode. They would sometimes be in a state of mania. So all of these reactions, they sometimes come into play when we're talking about these anti-psychiatric movements. So Liang was one of the movement that came into play, and that Basaglia and Foucault. So all of these movements, basically, they laid their foundation on the fact that the mental illness is not basically something, is not an entity, but it's only the normal stresses of life and how people react to these stresses of life. And the psychiatrists really jump into some diagnostic criteria. So that was their school of thought when they talk about that. So the myths about the mental illnesses, so there are a lot of myths that sometimes you would deal with. One of it is the young people and the children do not suffer from the mental illness. So it's one of the myth, and the answer to it is that young people and children are sometimes the high majority that is suffering from this mental illness. So so it's almost a ratio of 25%. The young children, the infants, the toddlers, they're suffering from these mental illnesses. Obviously, the factors are usually sometimes environmental, but still there are sometimes, and sometimes even the factors can be genetic as well. There are a lot of disorders now diagnosed as autistic disorders, and all of these disorders are basically the disorders that are revolving around the mental illness, and how they are basically the variants to the psychological capabilities of a person. So another myth that is quite common is that the mental illness is a person that is suffering from he or she who is suffering from the mental illness. They do not really recover, and they have to go on some sort of a long-term or a lifelong therapy. So that is not the case always. We have a lot of positive cases on record in which the people even who have been suffering from schizophrenia or from some extreme disorders, bipolar disorders, split personality disorders, will even have been able to be treated successfully. And that is the limelight over here. That is the mental illnesses can be recovered. They can be recovered, and the person can be helped out if he or she takes the help of the services surrounding him or her. Then another common phenomena that people see usually, and it is regarded basically as a myth, is that the people suffering from mental illness, they usually appear to be violent and danger, but it's not the case always. And then another mythology is basically the personal weakness in the character. So it can never be the case. It's not always the case until and unless the person is a drug addict or he is in a substance abuse. Then sometimes the people regard these mental illness as the single rare disorder in a particular person, because they're not aware of the lot of other variants that are surrounding them, and it's basically the lack of awareness that comes into play over here. Another myth is that it's not basically a true medical illness. So people do not always regard the mental illness, and they sometimes regard it as a personality disorder of a person, but it's not always the case. And sometimes these mental illnesses they are in need of help or the services surrounding them. So we talked about the myths, and then we are going to move on and relate to the facts that are surrounding the mental illness. Mental problems, they relate to 10 to 25% of young people, even less than 18 years. The recovery with appropriate treatment is sometimes 100%, and majority of the patients that they are suffering from mental illness, they are not violent in the majority of the cases. Then the cause is sometimes biological, psychological, and even the social factors can contribute towards these mental illnesses. And it's not a single disease, it's usually a collection of disease, and it's sometimes the variant of different mental illnesses that we see in a particular individual. So these are basically the facts and mythologies that are surrounding the mental illnesses, and one should have complete awareness if one is basically clinically working as a psychiatrist. So that is the end to this section. Thank you for watching sqadia.com.